Have you ever felt unusually tired for no reason? Or noticed a strange change in your skin tone or eyes? What if I told you that these seemingly random symptoms could actually be signs of a serious health condition, something that might even be affecting your liver? Your liver is one of the hardest working organs in your body, and when it's struggling, it can show up in unexpected ways. In this video, we're going to dive into 9 alarming signs that could point to liver disease, and trust me, some of them might surprise you. Stick around, because you might just spot something you've been ignoring for a while. Now, let's unravel these clues, and by the end, you'll be better equipped to understand your body and recognize the symptoms that need attention. So, let's get started. 1. Fatigue and weakness. If you're feeling more drained than usual, you might want to pay attention. Fatigue is one of the most common signs of liver disease, but it's also one of the easiest to dismiss. After all, we all have those days where we feel tired, right? But when this fatigue becomes overwhelming and doesn't improve with rest, it could be a sign that your liver is struggling. The liver plays a major role in detoxifying your body and converting food into energy. When it's not functioning properly, your energy levels can plummet. It's not just feeling tired after a long day, it's a constant, unshakable exhaustion that no amount of sleep seems to fix. This kind of fatigue often creeps up slowly, so you might not even realize it's related to liver health at first. If you've been feeling unusually weak or just off for a prolonged period, this might be a sign your liver needs some care and attention. 2. Yellowing skin and eyes, jaundice. You've probably seen someone with yellowish skin or eyes before. It's called jaundice, and it's a telltale sign that something might be wrong with your liver. The liver is responsible for breaking down red blood cells and eliminating the waste through bile. When the liver isn't working efficiently, the bilirubin from these broken cells builds up in the blood, causing that unmistakable yellow tint in the skin and the whites of the eyes. This is a clear indicator that your liver is not functioning as it should. If you notice your skin turning a yellowish shade, or your eyes looking a little more yellow than usual, don't ignore it. This is often a symptom of liver disease, like hepatitis or cirrhosis, which require immediate medical attention. 3. Swelling in the abdomen or legs. Have you noticed a bloated feeling in your stomach or legs that doesn't seem to go away? It's easy to brush off abdominal swelling as just a bad meal or too much salt, but persistent bloating could indicate liver problems. This happens because the liver's inability to produce certain proteins, like albumin, causes fluid to build up in your abdomen, called ascites, or legs. When your liver is damaged, it loses its ability to properly manage the fluids in your body. This can cause your abdomen to swell and feel tight, sometimes making it difficult to breathe comfortably. If you notice that your clothes are fitting tighter around your stomach or legs, and you can't seem to explain why, this could be a red flag that your liver needs attention. 4. Dark urine. Here's another sign that many people miss: dark-colored urine. If your urine has turned a shade that's closer to amber or tea rather than pale yellow, this could be a symptom of liver disease. When your liver isn't functioning properly, it can affect the way it processes waste and waste products like bilirubin, which can end up in your urine, turning it dark. Now, if you've been dehydrated, your urine might also be dark, but the difference here is that the dark color doesn't improve with more water. And if your urine is persistently dark and accompanied by other symptoms like fatigue or yellowing skin, it's time to pay a visit to your doctor. 5. Itchy skin. Itchy skin, or pruritus, can also be a sign that your liver isn't working as it should. This might sound strange, but when your liver is congested with toxins and unable to filter them out properly, they start to accumulate in your bloodstream. As these toxins build up, they can cause your skin to itch, sometimes intensely. It's not the usual dry skin itch that you can soothe with lotion. It's a persistent, deep, uncomfortable feeling that can make you want to scratch all over. If your skin has been itching without a clear cause, and especially if you notice other symptoms like jaundice or swelling, it might be time to take your liver health seriously. 6. Loss of appetite and unexplained weight loss. If your appetite has suddenly vanished or you're experiencing unexplained weight loss, don't brush it off as stress or a temporary issue. These could be signs that your liver is struggling to function properly. A diseased liver can interfere with your body's ability to digest and absorb nutrients, which can lead to a decreased appetite or unintentional weight loss. This is especially true in advanced liver conditions like cirrhosis. When the liver is unable to process fats, you may also feel nauseous or full after only a few bites of food. If you notice these symptoms alongside other signs like fatigue, swelling, or jaundice, it's essential to consult with a healthcare provider as soon as possible. 7. Nausea and vomiting. We've all had an upset stomach now and then, but when nausea becomes a regular occurrence, it could point to something more serious, like liver disease. When your liver isn't functioning properly, it can lead to a buildup of toxins in your body, which can cause nausea and vomiting. This can also be accompanied by a loss of appetite and discomfort after eating. Nausea related to liver problems isn't just a passing feeling, it can be persistent and happen even when you haven't eaten anything. If you find yourself feeling constantly queasy, especially if it's paired with other symptoms like yellowing skin or fatigue, don't ignore it. Your liver might be signaling for help. 8. Changes in stool color. Your stool can reveal a lot about your health, and when your liver is in trouble, it often shows up here too. If your stool becomes pale or clay-colored, this could indicate a problem with your liver or bile ducts. Normally, I'll give stool its brown color, but when your liver isn't producing enough bile, your stool might lose its color and become unusually light. In some cases, stools might also become tarry and black, which can be a sign of bleeding in the digestive tract, often due to liver-related issues like cirrhosis. If you notice a change in your stool color, especially if it's accompanied by other symptoms like nausea or swelling, it's important to seek medical advice. 9. Mental confusion and mood swings. Here's something that might shock you: liver disease can affect your brain. This condition is known as hepatic encephalopathy. When your liver isn't filtering out toxins properly, those toxins can build up in the bloodstream and affect your brain. This can lead to mood swings, confusion, memory problems, and difficulty concentrating. If you've been feeling off mentally, or if you've noticed that your mood swings are becoming more extreme, this might not just be stress or exhaustion, it could be related to liver function. Severe cases of hepatic encephalopathy can cause a person to become disoriented or even lose consciousness, which is why it's crucial to pay attention to these signs early on. So, there you have it: 9 signs that your liver could be in trouble. If you've noticed any of these symptoms, it's important to take them seriously. Your liver is a powerhouse that works tirelessly to keep you healthy, and if it's struggling, your whole body could be at risk. Don't wait for the signs to get worse, take action now. Remember, early detection is key to preventing liver disease from advancing to something more severe. So, if any of these signs sound familiar, don't hesitate to consult with a healthcare professional. Your liver will thank you, and so will your body. Thanks for watching this video. If you found it helpful, make sure to give it a thumbs up, subscribe to the channel for more health tips, and hit the notification bell so you never miss a video. Leave a comment down below if you have any questions or if you've experienced any of these symptoms yourself. Stay healthy, and I'll see you in the next video.